I am observing for genu varum and genu valgum. Can you face the side, please? And now I am observing for genu recurvatum, and I will compare bilateral. I am palpating for pain, swelling, and tenderness. I'm palpating the four borders of the patella and the vastus medialis, the vastus intermedius, and the rectus. The rectus femoris is deep to the vastus intermedius, and then the vastus lateralis. The patella tendon, the tibia, the femur, and the fibula. The popliteal fossa is here, and the popliteus muscle, the gastrocnemius, semimembranosus, the semitendinosus, and the bicep femoris. Good. So this is the medial joint line and medial meniscus. This is the MCL. The sartorius, the gracilis, and bend. This is the lateral joint line and lateral meniscus. The LCL and the IT band. For range of motion, I am looking for pain and limitation. This is active range of motion and knee flexion. So take this leg and pull it towards your butt. Like bend. Just do as much as you can. Okay. And then, that's fine. Wait. Okay. That's fine. And then flip. This is knee extension, so I'll push to the bottom into my hand as hard as you can. Okay. And then this is passive range of motion. I'm doing knee flexion. Oh, sorry. Knee extension. You ain't gonna like this. Medial tibial rotation and lateral tibial rotation. This is resistive range of motion. flexion. Wait, no, wrong. Resistive range of motion, knee extension. Okay. This is special test. This is the valgus stress test. Aspect of the ankle. I guess I'll do this one. Medial aspect of the ankle. Lateral aspect of the knee. This test is to, a positive sign for this test is to see pain and laxity, and this would indicate a MCL strain. The varus stress test is also a positive sign for pain and laxity, and this would indicate a LCL strain. Bend. This is Lockman's, and a positive sign in this test would be laxity, and this would indicate an ACL tear. Come down a little bit. Just so it's good. That's it. This would be pivot shift. And a positive sign in this test would be when the tibia moves anteriorly and clunks back into place during extension. A positive sign in this test would be ACL tear. Okay, I have to sit on your foot now. Okay, anterior drawer. A positive sign in this test would be laxity, and this would also indicate a ACL tear. And posterior drawer. A positive sign in this test would be posterior laxity, and this would indicate a PCL tear. Posterior sag. Positive sign in this test would be a dip in or a sag in the tibia, which would indicate a PCL tear. McMurray's. McMurray's would, a positive sign in this test would be pain and clicking under the thumb, and this would be an indication of a meniscus tear. Patellar apprehension. A positive sign in this test would be apprehension or visible pain on the patient's face, and that would indicate a patellar dislocation. This is Apley's, and a positive sign in this test would be pain and clicking, and this would be an indication of a meniscus tear.